You know that feeling? You're buckled in, cruising altitude, and that little thought pops in your head. What if someone has a medical emergency right now? Well, today we're going to pull back the curtain on the surprisingly calm and methodical system that kicks in when things go wrong in the air. I mean, it's a pretty nerve-wracking thought, right? You're in a sealed tube miles above the earth with no hospital in sight. So what actually happens when that call for help goes out? Is it just controlled chaos, or is there a real plan? First off, we have to understand the setting. An airplane cabin is a really unique place to handle a medical problem. Think about it. You have very limited space, a specific set of equipment, and absolutely no guarantee there's a doctor on board. It's because of these challenges that having a clear, established system is so essential. So here's our game plan for this explainer. First, we'll look at the unique challenge of an emergency at 35,000 feet. Then, we'll dive into the system airlines use to bring order to that chaos, breaking it down into 3 simple codes, from everyday stuff to life or death situations. And finally, we'll talk about the training that turns your flight crew into first responders in the sky. All right, let's get into it. You see, an emergency in the sky isn't just a medical problem. It's a huge logistical one. You could be hours from a hospital, you're in a pressurized cabin with slightly lower oxygen, and you've only got the equipment on board. It is a very high-stakes environment where every single decision counts. So, how do airlines bring order to all that potential chaos? Well, the key isn't luck, that's for sure. It's a solid system. It's a clear protocol designed to help the crew quickly and accurately figure out what's going on so they can make the right call right away. And that whole system is built around one simple number: 3. Every single in-flight medical event is classified into one of 3 distinct categories. And this isn't just for paperwork. This classification dictates the entire response. So this classification system does 3 really critical things. First, it helps the crew prioritize who needs care the most. Second, it makes sure they use their limited onboard resources effectively. And maybe most importantly, it guides them in making that huge call. Do we need to land this plane now? Let's start with the first category. We'll call this one Code Green. These are the most common issues crews see, and thankfully, they're the least severe. This is the kind of stuff where everyone can take a deep breath. Code Green situations are things a lot of us have probably experienced. That uncomfortable ear-popping pain, a little bit of motion sickness, maybe a headache, or just feeling dehydrated. These are all things that can be managed with basic first aid and some reassurance from the crew. So here's the bottom line for Code Green. While it might be uncomfortable for the passenger, it's not a threat to their life, and the flight is going to continue to its destination. The crew can handle it. Okay, now we're going to escalate things a bit to Code Yellow. These are conditions that are definitely serious and need immediate attention, but they aren't considered immediately life-threatening. The key phrase here is watch and wait. So examples here might be a passenger having a moderate asthma attack who responds to their inhaler, or maybe someone who faints but recovers quickly. It could also be a bigger injury like a sprain or some bleeding that's been brought under control. The situation is serious, but for now, it's stable. This watch and wait approach is really the heart of a Code Yellow response. The crew, and they're probably talking to medical support on the ground, will be continuously monitoring the passenger. The big question is the situation getting better or is it getting worse? The answer to that question determines if a diversion is necessary. And that brings us to the most critical category, Code Red. These are the true, life-threatening emergencies where immediate, decisive action is absolutely required to save a person's life. This is where all that training really kicks into high gear. We're talking about the most serious things you can imagine happening on a plane. Cardiac arrest, a severe allergic reaction, a stroke, or chest pain that looks like a heart attack. In these moments, every single second counts. And for a Code Red, there's a very clear step-by-step protocol. The crew is trained to recognize the signs, tell the captain immediately, and get out the advanced equipment, like the defibrillator or emergency oxygen. This is when they make that famous call for a doctor on board, contact medical support on the ground, and get ready for an emergency landing at the nearest possible airport. So let's put it all together. As you can see right here, this entire system is designed around one critical decision: diverting the plane. For a Code Green, it's a clear no. For a Code Red, it's almost certainly a yes. But for that Code Yellow, that's the gray area. And that's where the crew's training and observation and communication is just absolutely vital. Now that we understand the system, we have to talk about the people who actually execute it. Your cabin crew members are so much more than service professionals. They are, in fact, trained first responders. And that's not just a nice idea. Medical experts like Doctors Renuka and Sandeep Kumar Verma have emphasized this, saying, quote, cabin crew are trained first responders on board and play a key role in managing in-flight emergencies. They're trained to assess the situation, give aid, use the emergency equipment, and communicate with everyone who needs to be in the loop. So the big takeaway from all this is that for every type of medical event that can happen in the air, there is a calm, methodical system designed to manage it. It's a plan designed to replace panic with process. And that leaves us with one last thought. We've just walked through the cruise protocol, from code green to code red. But what would you do if you were on that flight and you heard that call? Is there a doctor on board? It's a question worth thinking about the next time you fly.